The Rural Immersion Program is a new innovative program in Year 1 of the new Doctor of Medicine program that UQ has implemented this year, and it's where we had the opportunity to send students out to rural communities, small towns, to get a real first-hand, authentic experience of what it's like to live and work in a rural community.
They had a chance to go out, see the rural facilities, the medical and paramedical facilities, and toured the ambulance centre, the medical centre and the hospital. And then they had a cultural immersion out on country. We've just been blown away by the experience here out on Garanda Station.
It wasn't just about learning about the medical side in rural communities, but it was also getting to learn about the community, understanding what it's really like to be in those communities. What are the opportunities, the benefits, the charms, but also the challenges of living and working in rural Queensland.
I think it's really shown how rural health is different from metropolitan health and medicine specifically, but also how every rural community is different. You learn a lot in uni with UQ about how rural and remote medicine is different from metropolitan medicine, but every community is truly different and has its strengths and weaknesses.
Rural medicine is really important to me and my family and my whole community where I grew up, and I think that it's something that I'll get a lot more experience, a lot more hands-on experience. I know that I'm going to get to know the people that I'm working with and they're going to get to know me, and then to be able to go on in that career and really give back to a community that gave so much to me growing up.
So I think it's really important to showcase rural health and really get students immersed into the rural and regional environment. There's a lot of benefits for working regionally, including more practical hands-on experience, a greater range of placements and really feeling immersed in the community. So it's really great for students to get an insight into that opportunity and understand where they'll be doing their placements and hopefully look at doing future careers here.
I really enjoyed going to Kingaroy Hospital. It was really good to see good facilities and good technology there.
I personally trained a lot of my training rurally, and I found it extremely beneficial. Early on I was embedded within a small hospital that took care of me and that gave me a lot of exposure to things that people in the city just didn't get to see because of the large hierarchy above them.
With the community support and with Bruce's passion and the whole kind of community coming together to make it something really special, that was really inspiring. I think they're really punching above their weight in terms of services and quality of service, and that was something that I think, yeah, I could really aspire to that in rural medicine.
It really felt like we were already part of the community just from a single weekend. Just the sheer volume of people who, as soon as they met us, said, we need a doctor down here. And it was, you know, it was something that you can read about in the research papers and look at the statistics for, but to actually feel that from the residents of Childers and to extend that to residents all around rural areas in Australia, I think it really grounded a lot of the more theoretical stuff that we do.
They've learnt that rural communities have some wonderful attributes, the caring, the continuity, the challenge of rural practice and being able to step up to that challenge. And they've seen what it's like to be a rural doctor. You cannot be what you cannot see. And so it's really important for the students to be able to see this. We're certainly proud in the University of Queensland. Our Vice-Chancellor recently said that we're the university for Queensland, not just of Queensland. We see this as a chance to make a difference to the health system and get future doctors out into communities that deserve them.